Welcome to our step-by-step tutorial on how to sign up for Medicare. Before diving in, confirm that you meet Medicare eligibility requirements. Typically, you are eligible if you're 65 or older, under 65 with certain disabilities, or have End-Stage Renal Disease, ESRD. If you're already receiving Social Security benefits, you'll be automatically enrolled in Medicare Parts A and B. If you're not automatically enrolled, you can sign up for Part A and Part B during your initial enrollment period, IEP, which begins 3 months before your 65th birthday and ends 3 months after and includes your birth month for a total of 7 months. You can enroll online at the Social Security website, by phone, or in person at your local Social Security office. Medicare offers several parts: Part A, hospital insurance; Part B, medical insurance; Part C, Medicare Advantage; and Part D, prescription drug coverage. Research each part to understand what coverage you need. Consider additional coverage like Medicare Advantage, Part C, which combines Part A, Part B, and often Part D. Also, you can consider a Medicare supplement plan, Medigap, that can help cover out-of-pocket costs not covered by original Medicare. Compare options based on your healthcare needs and budget. If you want standalone prescription drug coverage, you'll need to enroll in a Part D plan unless you have it through a Medicare Advantage plan. Don't get caught up by one of these enrollment penalties. If you don't enroll in Part B, you could be charged a lifetime penalty of 10% for every 12-month period you did not have creditable Part B coverage. Part D is similar, however it's a lifetime penalty of 1% for every month you don't have creditable Part D coverage. Signing up for Medicare can be complicated, but help is available. Contact Darren Whitehour at ECOS Medicare Solutions for personalized guidance. Reach out via email at darrenwhitehour@ecos.care, visit ecosmedicaresolutions.com, or call 888-895-3267 for assistance.